This podcast episode is for educational and informational purposes only. I am not a doctor, and I am not giving medical advice. Peptides are research compounds that are not approved to diagnose, treat, cure, or prevent any disease. Always talk to a qualified healthcare provider before starting, stopping, or changing anything related to your health. Never use research compounds without understanding the risks, side effects, sourcing issues, and legal status in your area. Alright friend, let's talk about one of the most underrated peptides in the peptide world, and honestly, one of my personal favorites for gut issues, inflammation, and skin problems. Today's episode is all about KPV. If you have ever dealt with bloating, food sensitivities, leaky gut symptoms, IBS-type flare-ups, autoimmune inflammation, eczema, psoriasis, or even stubborn acne, you're going to want to pay attention. Because KPV is one of those peptides that people don't talk about enough, but when you understand what it does, you start realizing why so many people quietly swear by it. So, let's start with the basics. What is KPV? KPV is a small peptide fragment made from a much larger naturally occurring protein in the human body called alpha-MSH, also known as alpha-melanocyte stimulating hormone. Now, alpha-MSH is involved in a lot of processes in the body, including inflammation control, immune response, and skin pigmentation. But KPV is a specific 3 amino acid sequence pulled from alpha-MSH. And those 3 amino acids are lysine, proline, valine. That is why it is called KPV. K stands for lysine, P stands for proline, V stands for valine. It is tiny, but do not let that fool you, because small peptides can be incredibly powerful. And KPV has become popular because it seems to have a unique ability to calm inflammation, especially in the gut and the skin, without acting like a steroid. That is one of the biggest reasons people love it. It is like the body's natural inflammation calming signal. Now, I want to be clear. Most of what we know about KPV comes from research and anecdotal reports, and we need more large human studies. But the existing research is interesting enough that it has become a staple in the peptide community. So what does KPV do? Let's talk mechanism in plain English. KPV appears to work by regulating inflammatory cytokines. Cytokines are basically chemical messengers in the immune system. Some cytokines help fight infection, but some cytokines, when they get too high, cause chronic inflammation. And chronic inflammation is at the root of a lot of modern health problems. From autoimmune disease, to gut inflammation, to skin disorders, to joint pain, to metabolic issues, to even mood problems. So KPV is interesting because it may reduce inflammatory cytokines like TNF-alpha, interleukin-6, and other pro-inflammatory signals. Basically, it tells the immune system, calm down, stop overreacting, stop attacking everything like it is a threat. Now here is the thing. Many people think inflammation is always bad. But inflammation is not always bad. Inflammation is the body's emergency response system. The problem is when inflammation gets stuck in the on position. When your immune system becomes like a smoke alarm that goes off every time you make toast. KPV may help turn that alarm down. Not shut it off completely, but regulate it. That is why people describe it as immune modulating, not immune suppressing. That is an important difference. Immune suppressing means your immune system gets weakened. Immune modulating means it is being guided into balance. Now, let's talk about why KPV is so popular for gut health. Gut inflammation is extremely common, and a lot of people don't even realize they have it. They just think they are bloated, or tired, or have brain fog, or have weird skin flare-ups, or random anxiety, or joint pain, or they have food intolerances that seem to get worse over time. And sometimes what is happening is the gut lining is irritated and inflamed. Now, the gut lining is supposed to be a protective barrier. It keeps toxins, bacteria, and undigested food particles where they belong, inside the gut. But when the gut becomes inflamed and irritated, that lining can become more permeable. That is what people call leaky gut. Now, leaky gut is not an official diagnosis in mainstream medicine, but increased intestinal permeability is absolutely a real thing that has been studied. And when that barrier gets compromised, the immune system can become reactive. It starts fighting things it should not be fighting. That is where autoimmune symptoms can flare. That is where chronic inflammation can build. That is where histamine issues can get worse. That is where your whole system starts acting like it is under attack. KPV is one of those peptides people use specifically to calm down that gut inflammation. And people often stack it with other gut peptides like BPC-157, TB500, or even GHK copper for healing support. But KPV is special because it is more about calming the immune response and less about tissue repair, although those things overlap.
So think of KPV like this.
If BPC-157 is the construction crew rebuilding the gut lining, KPV is the person showing up and stopping the riot. It tells the inflammatory chaos to settle down so the body can actually repair. Because you cannot heal effectively if you are constantly inflamed. Now, let's talk about one of the most fascinating things about KPV. It may have antimicrobial properties. That means it may help fight certain bacteria and yeast. Now, that does not mean it is an antibiotic. But some research suggests KPV may inhibit the growth of candida. And candida overgrowth is another big topic in the gut health world. Many people deal with chronic yeast issues, bloating, sugar cravings, fatigue, brain fog, and skin issues. And they go through cycle after cycle of antifungals. But the root issue may be inflammation and immune dysfunction in the gut. So KPV is interesting because it might not just calm inflammation. It might also help shift the gut environment in a healthier direction. Now, that brings me to another huge reason KPV has become a fan favorite.
Skin.
Skin is basically a mirror of what is happening inside the body. And when the gut is inflamed, the skin often shows it. Eczema, psoriasis, rosacea, acne, dry, irritated skin,
Hives.
rashes. All of those can be connected to inflammation and immune overactivity. Now, KPV comes from alpha MSH, which has strong ties to skin regulation. So it makes sense that people started experimenting with KPV for inflammatory skin conditions. And a lot of users report improvements in eczema and psoriasis symptoms. Less redness, less itching, less flaking, less irritation. And not just surface-level improvement, but deeper reduction in inflammation. Now, do we have enough human clinical trials to say KPV is a guaranteed cure?
No.
But we have enough signals that it is worth paying attention to. And the anecdotal data is strong enough that KPV has become a go-to peptide for people dealing with inflammatory skin issues. Now, let's talk about autoimmune conditions. KPV is often discussed in autoimmune circles because of its immune-modulating effects. Autoimmune conditions are complicated. They involve genetics, environment, gut permeability, immune imbalance, stress, toxins, and more. But the common theme is immune system confusion. The immune system starts attacking the body's own tissue. Now, many autoimmune patients are placed on immunosuppressive drugs. Those can be life-saving, but they also come with risks. So, a lot of people are looking for ways to support immune balance without shutting everything down. That is why peptides like KPV are gaining interest. Because if KPV can help regulate inflammatory cytokines, it might reduce autoimmune flares. Now again, I want to be careful with wording. KPV is not an autoimmune cure, but it may be a tool that helps some people reduce inflammation. And in autoimmune disease, reducing inflammation can mean reducing symptoms. Now, one condition where KPV is talked about a lot is inflammatory bowel disease, such as Crohn's disease and ulcerative colitis. Those are serious conditions. And research has explored alpha MSH derivatives for colitis models. In animal studies, KPV showed promising anti-inflammatory effects in the gut. That is where a lot of the excitement started. Because ulcerative colitis and Crohn's are basically inflammatory chaos in the intestines. So if KPV can calm inflammation in those models, it makes sense that people with IBS or milder gut inflammation might also benefit. Now, another area people use KPV for is histamine intolerance and mast cell issues. This is a big one, because mast cells are part of the immune system. And when mast cells get triggered, they release histamine. That can cause flushing, itching, anxiety, rapid heartbeat, gut cramps, headaches, and all kinds of weird symptoms. Now, not everyone with these symptoms has mast cell activation syndrome, but histamine issues are becoming more common. And gut inflammation is strongly connected to histamine problems, because the gut is where a lot of histamine regulation happens. So some people find that when they calm their gut inflammation, their histamine symptoms improve. And KPV is one peptide that is frequently mentioned for this. Now, let's talk about the different forms of KPV, because this matters. KPV is commonly used in oral capsule form, and that is unusual for peptides, because most peptides get broken down in the digestive tract. But KPV is small enough and has been formulated in ways that may allow it to still have effects in the gut. And honestly, if the goal is gut inflammation, oral makes sense, because you want it acting locally in the gut. Now, KPV is also used as an injectable peptide. Some people prefer subcutaneous injections because they believe it provides more systemic benefits, meaning it may circulate through the bloodstream and influence inflammation throughout the body. People who are using KPV for skin, autoimmune, or whole body inflammation sometimes choose injectable. There is also topical KPV. Some people mix it into creams or serums and apply it directly to irritated skin, especially for eczema patches, psoriasis plaques, or inflamed acne areas. Now, topical KPV is a very popular hack in the peptide world, because if the skin is inflamed, why not apply the anti-inflammatory peptide directly to the area? Some people even stack KPV topically with GHK copper, or with BPC-157, or even with hyaluronic acid serums. Now, let's talk dosing, because everyone always asks, what is the typical dose of KPV? Most common dosing ranges that you will hear in the peptide community for injectable KPV are around 200 micrograms to 500 micrograms per day, sometimes up to 1 milligram per day. But usually people start lower. A lot of people do something like 250 micrograms once daily, or 250 micrograms twice daily. Some do 500 micrograms once daily. Now, oral KPV dosing varies a lot. Some oral products are dosed at 1 milligram. Some are 5 milligrams. Some are 10 milligrams. Some even higher, because oral peptides often require a higher dose since absorption is different. And for topical use, dosing is extremely variable depending on how it is mixed. Now, let's talk about cycling. Many people run KPV for 4 to 8 weeks. Some do longer. Some do short bursts during flare-ups. Like if their gut is acting up, they run it for 2 weeks. If their skin is flaring, they run it for a month. Now, the good news is KPV is generally described as well tolerated. It is not known for harsh side effects like some other peptides, but that does not mean it is risk-free. Anything that affects immune response could potentially cause unexpected effects in some people. Now, what side effects do people report with KPV? The most common side effect people mention is mild fatigue. Some people feel calmer, almost sedated. Some people report mild nausea, especially if their gut is already irritated. And some people feel nothing at all except improvement in symptoms. Injection site irritation can happen if using injectable, redness, swelling, a little itching. Now, if you are prone to allergic reactions, you should be careful, because peptides can cause immune responses, especially if you have contamination issues or low-quality sourcing. Which brings me to an important point. Sourcing matters. KPV is a peptide where purity matters a lot. If you get a low-quality peptide, you could end up with more inflammation, not less, because your body might react to impurities. So if you are considering KPV, this is not something to buy from random sketchy sources. Now, let's talk about stacking KPV, because KPV is rarely used alone. It is usually part of a gut healing or inflammation calming stack. The most common stack is KPV plus BPC-157. That is the classic gut duo. KPV calms inflammation. BPC supports healing and repair. People often call it the 1-2 punch for gut health. Another stack is KPV plus TB500. That is more for systemic inflammation and tissue repair. Another stack is KPV plus GHK copper. That is especially popular for skin, wound healing, and anti-aging. Now, for autoimmune and inflammation issues, people sometimes stack KPV with thymosin alpha-1. But that is more advanced, because thymosin alpha-1 is a powerful immune modulator. So that combo is not something to casually throw together without understanding what you're doing. Another interesting combo is KPV with glutathione, because glutathione supports detox pathways and reduces oxidative stress. And oxidative stress and inflammation go together like gasoline and fire. So if you reduce oxidative stress, you often reduce inflammation. Now, I want to mention something important. KPV is not a fat loss peptide. It is not a muscle-building peptide. It is not like GLP-1 peptides. It is not like growth hormone secretagogues. KPV is more of a healing peptide, a calming peptide, a balancing peptide. So if you are looking for rapid visible changes like dramatic appetite suppression, KPV is not that type of compound. KPV is more like you wake up one day and realize,
Wow.
my gut feels calmer. My skin looks better. My inflammation is down. My flare-ups are less frequent. My body feels like it is not constantly in fight mode. It is subtle, but powerful. Now, let's talk about the science a little deeper, but still in an easy way. Alpha MSH is part of a system in the body called the melanocortin system. This system affects inflammation, appetite, stress response, and pigmentation. KPV is derived from alpha MSH and is believed to interact with inflammatory pathways like NF-kappa B. Now, NF-kappa B is a major inflammatory signaling pathway. If NF-kappa B is constantly activated, you're basically stuck in chronic inflammation mode. A lot of inflammatory diseases involve overactive NF-kappa B signaling. So when peptides like KPV reduce NF-kappa B activation, that is a big deal. Because it is not just symptom management. It is shifting a root inflammatory pathway. Now, another interesting thing about KPV is that it may help regulate the gut microbiome indirectly. Because when inflammation decreases, the gut environment becomes less hostile. When the gut environment becomes healthier, beneficial bacteria can thrive. And when beneficial bacteria thrive, the gut barrier improves. And when the gut barrier improves, inflammation decreases. So it becomes a positive cycle. That is why some people say KPV is like a reset button for the gut. Now, let's talk about who might benefit from KPV. In the peptide community, KPV is often recommended for people who deal with IBS symptoms, inflammatory bowel disease symptoms, bloating and gut irritation, food sensitivity reactions, eczema and psoriasis, chronic skin inflammation, acne that seems inflammation-driven, autoimmune inflammation, joint pain linked to inflammation, histamine intolerant symptoms, mast cell type symptoms, chronic low-grade inflammation. Now, KPV is also sometimes discussed for people who are dealing with chronic stress. Because chronic stress raises inflammation. Cortisol and stress hormones can mess with gut permeability. They can shift immune balance. They can worsen autoimmune symptoms. They can worsen skin issues. So while KPV is not a stress peptide, by calming inflammation it may indirectly help people who are stuck in stress-induced inflammatory cycles. Now, who should be cautious with KPV? Anyone who is pregnant or breastfeeding should not be using research peptides. Anyone who is immunocompromised should be extremely careful. Anyone on immune-suppressing drugs should talk to their doctor. Because even though KPV is not considered a classic immune suppressor, it still interacts with immune pathways. And anyone with a history of severe allergic reactions should start extremely low or avoid it. Now let's talk about administration and timing. When do people take KPV? Most people take it daily. Some take it twice daily. Many people take it in the morning. Some prefer nighttime because it makes them feel relaxed. If someone is using it for gut inflammation, they may take it around meals. If they are using oral KPV, they may take it on an empty stomach. But honestly, timing is not as strict as with peptides like growth hormone secretagogues. KPV is not dependent on insulin spikes the same way. Now, topical KPV is usually applied once or twice daily, often on clean skin. Some people use it after microneedling, but I will say that is a very advanced approach because microneedling increases absorption. And if you're using a peptide after microneedling, purity matters even more, because you do not want contaminants entering deeper layers of the skin. Now, let's address a question people ask a lot. How fast does KPV work? Some people notice improvements within days, especially with skin redness and gut discomfort. Others take a couple weeks. And for chronic conditions, it may take a month or more to really notice major changes. Now, this is important. If you are inflamed for years, you cannot always expect to heal in 3 days. But many people report that KPV gives them a sense of calm in the gut quickly, almost like their digestive tract is less irritated. Now, another question. Is KPV safe long-term? We do not have enough long-term human data to say for sure. But because KPV is derived from a natural hormone fragment in the body, many people feel comfortable cycling it longer. Still, I recommend cycling and paying attention to your body. And always remember, just because something is natural does not mean it is automatically safe. Hemlock is natural. So is poison ivy. So use common sense. Now, let's talk about something else KPV might help with. Inflammation in general. If you think about the modern world, we are exposed to processed foods, environmental toxins, stress, lack of sleep, alcohol, seed oils, sugar overload, antibiotics, mold exposure, microplastics, and all of these things can inflame the gut and immune system. So KPV fits into a larger wellness strategy. But it is not magic. If you are eating garbage, sleeping 4 hours a night, and living in chronic stress, no peptide is going to fully fix that. But KPV can be a supportive tool while you clean up the foundation. Now, let's talk about KPV and weight. People sometimes ask, does KPV cause weight loss? Not directly. However, if gut inflammation is causing bloating and water retention, you might lose some of that swelling. Also, if inflammation goes down, insulin sensitivity can improve. And when insulin sensitivity improves, weight management becomes easier. But KPV is not like semaglutide. It is not going to shut off your appetite. It is not going to make you drop 20 pounds in 2 months. It is a healing peptide. Now, let's talk about real-life examples, because I want you to picture the type of person who might benefit. Imagine someone who says, every time I eat, I bloat. I feel inflamed. My stomach hurts. My bowel movements are unpredictable. I have skin rashes. I have fatigue. I feel like my body is reacting to everything. That is a person who might look into KPV. Or imagine someone who says, I have eczema patches that flare randomly. I have tried steroid creams. They help temporarily, but it always comes back. That is another person who might explore KPV, especially topical. Or imagine someone who says, I have autoimmune flare-ups and inflammation. I feel like my body is constantly attacking itself. I want to support immune balance, naturally. That is someone who might look into KPV as part of a broader plan. Now, I want to mention something important. KPV is not a replacement for medical care. If you have Crohn's disease, ulcerative colitis, or serious autoimmune disease, you need to work with a medical provider. Peptides should not be used as a substitute for necessary medication. They should be considered an experimental supportive tool. Now, let's talk about something else. KPV is often described as one of the best peptides for people who are sensitive, because it is not harsh. It is not overly stimulating. It is not aggressive. Some peptides can make people feel wired. Some peptides can cause headaches. Some peptides can cause blood sugar shifts. KPV is generally gentle. That is why many people start with KPV when they are new to peptides. Now, another topic. KPV and gut-brain connection. This is fascinating. Your gut produces neurotransmitters. Your gut communicates with your brain through the vagus nerve. Your gut microbiome influences your mood. And chronic gut inflammation is strongly linked to anxiety and depression. So some people report that when their gut calms down, their mood improves. Now, KPV is not an antidepressant. But if it reduces gut inflammation, it may indirectly support mental clarity and emotional stability. That is why some people say, when I take KPV, I feel calmer. I feel less anxious. My brain fog lifts. And again, that might not be a direct brain effect. It might be a gut effect that leads to brain improvement. Now, let's talk about practical advice. If someone is going to run KPV, what should they do alongside it?
First,
Clean up your diet. If you are trying to heal your gut, reduce inflammatory foods. For many people, that means cutting back on processed foods, sugar, alcohol, and fried foods.
second,
Support your gut lining. That can include things like collagen, bone broth, glutamine, zinc carnosine, and probiotics. Third, reduce stress. Stress destroys gut health. It is not optional. If you are stressed all the time, your gut will pay the price.
fourth,
Sleep. Sleep is when healing happens.
fifth,
Hydration. Inflammation is worse when you are dehydrated. Now, I want to talk about a common question. Can you take KPV with GLP-1 peptides? Many people do. There is no widely known conflict, but you need to pay attention to your digestion. Because GLP-1 peptides slow gastric emptying. And if your digestion is already sluggish, adding more gut-focused compounds can make you feel weird at first. Not necessarily bad, but different. Now, another question. Can KPV be used with antibiotics? Some people use it to support gut recovery after antibiotics, because antibiotics can disrupt the microbiome and irritate the gut lining. So KPV could theoretically help calm inflammation while the gut is rebuilding. Now, I want to mention the topic of dosing accuracy. If you are using injectable KPV, you need to know how to reconstitute properly. You need sterile technique. You need bacteriostatic water. You need proper storage. And you need to avoid contamination. Because the last thing you want is injecting bacteria into your body. Now, oral KPV is simpler, but quality still matters. And topical KPV should be handled carefully as well. Now, let's talk about what KPV is not. KPV is not a growth hormone peptide. It is not a testosterone booster. It is not the libido peptide. It is not a tanning peptide. It is not a fat burner. It is not a stimulant. It is not a miracle anti-aging peptide. But it can support anti-aging indirectly. Because inflammation is one of the biggest drivers of aging. Chronic inflammation is sometimes called inflammaging. And if you can reduce inflammation, you can improve skin health, energy, recovery, and overall aging markers. So while KPV is not an anti-aging peptide like epithalon or thymalen, it still fits into an anti-aging protocol. Because aging is not just wrinkles. Aging is inflammation. Aging is mitochondrial dysfunction. Aging is immune dysregulation. Aging is gut breakdown. So KPV can absolutely be part of a longevity stack. Now, one more topic. KPV and inflammation from injuries. Some people use KPV for joint pain or inflammation from injuries, but usually they combine it with BPC-157 or TB500, because KPV reduces inflammatory signaling, while BPC and TB help repair tissue. So KPV alone might help pain and inflammation, but combined, it can be more powerful. Now, I want to address something that always comes up. How does KPV compare to BPC-157? They are different. BPC-157 is about repair, healing, angiogenesis, blood vessel formation, tissue recovery, gut lining repair. KPV is more about calming inflammation, immune modulation, cytokine reduction. So they are complementary. They are not competing. It is not a question of which is better.
It is more like,
which one do you need more?
or,
Why not use both if appropriate? Now, KPV also gets compared to LL37 sometimes. But LL37 is more antimicrobial and immune active. KPV is more calming. So if LL37 is like a guard dog, KPV is like a meditation coach. Now, another interesting note. Because KPV comes from alpha MSH, some people wonder if it affects pigmentation. In the peptide community, KPV is not usually used for tanning. That is, more melanotan. KPV is more of an anti-inflammatory fragment, not a tanning peptide. So you do not typically see pigmentation changes from KPV use. Now, I want to talk about something that matters a lot. Expectations. When people start peptides, they often expect a dramatic transformation. But KPV is not like that. KPV is the type of peptide where you might realize, my gut is less reactive. My skin is calmer. My inflammation markers are improving. I am not flaring as often. I feel more stable. And that stability is powerful. Because when your inflammation goes down, your body can finally focus on healing. Now, let's talk about the most common protocols people run. Protocol number 1. Gut Healing Protocol. KPV Daily. BPC-157 Daily. 4 to 8 weeks. Sometimes oral KPV plus injectable BPC. Or injectable KPV plus injectable BPC. Sometimes both oral and injectable. Protocol number 2. Skin Inflammation Protocol. Topical KPV applied daily. Possibly combined with topical GHK copper. Some people also take injectable KPV for systemic inflammation. Protocol number 3. Autoimmune Support Protocol. Injectable KPV daily. Sometimes combined with thymosin alpha-1 or thymallin or other immune peptides. But again, that is advanced. Protocol number 4. Histamine and mast cell support. Oral KPV daily. Sometimes combined with quercetin DAO enzyme and a low histamine diet. Now, what about dosing frequency? Many people like splitting KPV into 2 doses per day, morning and night, especially if they're dealing with gut flare-ups, because inflammation can spike after meals.
Now, storage.
KPV should be stored properly. If reconstituted, it is usually stored in the refrigerator. If unreconstituted, it should be stored in a freezer. And you should avoid repeated temperature changes. Now, what about KPV and women's hormones? KPV is not primarily a hormone peptide, but inflammation affects hormones. So indirectly, by lowering inflammation, some women report improvements in PMS symptoms, cycle regularity, and general hormonal stability. But again, not a direct hormone effect. Now, one more fascinating topic. KPV and wound healing. Because inflammation control is part of wound healing. If a wound is too inflamed, healing slows down. So some people use KPV topically on irritated wounds or inflamed skin lesions. Now, I am not saying to put it on open wounds without understanding sterility. But the concept is there. Inflammation control supports healing. Now, let's talk about what makes KPV different from typical anti-inflammatory supplements. Most people use things like turmeric, fish oil, magnesium, and anti-inflammatory diets. And those are great. But KPV is different because it is a signaling peptide. It is like a message molecule. It tells your immune system what to do. Supplements are more like building blocks. Peptides are like instructions. That is why peptides can be so powerful. Now, let's talk about the elephant in the room. Why is KPV not mainstream? Because peptides are not widely studied in clinical practice. Because pharmaceutical companies cannot patent a simple natural peptide fragment easily. Because doctors are not trained on peptides in medical school. Because research peptides live in a gray zone. And because most mainstream medicine is focused on drugs, not bioregulatory signaling molecules. But the interest is growing. And KPV is one of those compounds that I think will eventually become much more well-known. Now, let's wrap this up with some key takeaways. KPV is a 3-amino acid peptide derived from alpha-MSH. It is known for anti-inflammatory effects, especially in the gut and skin. It may help regulate cytokines like TNF-alpha and reduce inflammatory signaling pathways. It may support gut barrier health and immune balance. It may have antimicrobial effects, including possible candida inhibition. It is often used for IBS, gut inflammation, leaky gut-type symptoms, eczema, psoriasis, acne inflammation, and autoimmune flare support. It can be taken oral, injectable, or topical. And it is commonly stacked with BPC-157 for gut healing. Now, I want to say this clearly. If you are struggling with chronic inflammation, gut issues, or skin issues, you do not have to suffer forever. There are more tools now than ever. And peptides like KPV are part of the new frontier of healing. Just be smart. Do your research. Source carefully. Start low. track your results, and treat your body like the high-value machine that it is. Because you only get one. This podcast episode is for educational and informational purposes only. I am not a doctor, and I am not giving medical advice. Peptides are research compounds that are not approved to diagnose, treat, cure, or prevent any disease. Always talk to a qualified healthcare provider before starting, stopping, or changing anything related to your health. Never use research compounds without understanding the risks, side effects, sourcing issues, and legal status in your area. Thanks for listening, keep learning, and stay curious.